So we're gonna just talk about how to find providers when you have XYZ insurance. So do you have Medicare? What plan do you have?
I have a Humana plan.
You have a Humana plan, okay. So there are a whole bunch of different HMOs or providers that offer plans through Medicare, through Medicaid, which is TennCare, through employer-sponsored coverage, and through the marketplace. The big ones are Aetna, which is the most popular through employers, Blue Cross Blue Shield, Cigna, United Healthcare, and Humana. So we'll look at all of the different ones. We'll start with Humana since that's what you have. Okay, so you said you have it through Medicare, and we'll just say it's a Humana Honor PPO.
Yes.
Because that's usually the most common. So all I did, let me take it back a step, was Google, find a provider, Humana Medicare. So Humana has a couple of different sections. So they have their Medicare Advantage, they have their Medicare Standards, and then they have employer-sponsored coverage. So you want to make sure that you're looking for the Medicare ones, because some providers that take, say, the job-sponsored coverage form of Humana don't necessarily take the Medicare form of Humana. So you want to make sure that you're looking at the right kind. So we are looking for, let's do this again, Honor, and then let's just say that we're looking for primary care. Okay, so there is, let's see how many results. It's not going to tell me the number. There's a lot in the Cookeville area that take Humana. So let's say that you want only ones that have 4 or more stars or hearts, and you want a female, and you want somebody that speaks, let's say, Spanish and English. English is always the default, so you don't have to put that. Okay, now let's go back and filter those results. Okay, that narrows our list down. Now, some of the things that you're going to, yeah.
Hey, that's actually my preferred provider.
It is. That's funny.
That's the reason I said, oh.
That's funny.
She has never spoken any Spanish to me.
Oh.
Why would she?
Yeah, true. So some of the things that you're gonna wanna look at are established patients only. So it has an X next to it, which means that they are taking new patients. If there was the check mark next to it, let's see if we can find one. That means that they are not taking new patients.
Okay.
So you'll see this one says accepting new patients.
Uh-huh.
This one says established patients only. If you are looking for a new provider, you want to make sure that you are recognizing that not all doctors are taking new patients. Some have hit capacity, some only take a certain amount of Medicare patients, or a certain amount of TennCare patients, or a certain amount of marketplace patients, because the payouts are different.
What is Marketplace?
Marketplace is healthcare.gov. It used to be called Obamacare.
Okay.
Now it is the Affordable Care Act.
Okay.
But it is where a whole bunch of different insurance companies come together and offer plans for people who don't qualify for Medicare or TennCare or job-sponsored coverage. Excuse me. Humana is not on the marketplace, so that won't be a big issue with Humana just because they don't offer plans on the marketplace in Tennessee. Okay, so then let's say instead of a primary care, let's say that you are looking for a neurologist. spelled that right. Okay, oh, that says oncology, here we go. And let's see, you want specifically somebody that is accepting new patients. So now you can see again, accepting new patients, this is their specialty. This is pretty cool too. Some of them have that cultural competency, or there's also an LGBTQAI plus one that they can take. They're just different sensitivity trainings that they can take. So there's a cultural competency, and there is a LGBTQI plus one. I think those are the only two as of right now. So that is the Humana. Do you have any questions on that? Did I show you how to find the provider on the Humana site?
Yes, but I don't know that I mean, you know, you sort of came up with what I already had.
So is there anybody that you don't have that you think you might need?
Yeah, and I don't know anything but Dr. Wilson.
Okay.
And their hand specialist.
Okay. Is he a neurologist? Is he in Cookville?
Yes.
Is that him?
I have no idea. I only have,
Okay.
I'm probably gonna have to have carpal tunnel surgery.
Okay. Okay, it looks like it is this dude, vascular surgeon. That sounds right if it's for carpal tunnel. Okay. So vascular surgery is what his specialty is. And so it shows, you just type in, or you can put in, let's see, you said for carpal tunnel. Oh gosh, I'm gonna butcher the spelling of this. Well, let's see if it'll give us something on that. Sometimes the sites are intuitive, sometimes they're not. Okay, so I just typed in carpal tunnel.
Okay.
That's all I put in there. So this is who they're giving us in the Cookville area that it looks like most of them are orthopedics. And there is, let's see. A lot. It doesn't exactly tell us how many. I hate when it does that. Let's see. So there are all of these orthopedics or people who have put in their bio or their list of.
Okay. I'm gonna question your data.
No, go for it.
I don't think John Turnbull accepts Humana anymore.
Okay, that's good to know.
In fact, as understand it,
Mm-hmm.
that whole group is no longer accepting,
The Campbell Clinic?
uh-huh.
Well, let's go do some research. And of course, they're only pulling up ones in Memphis. That's different than tier 1. Those are two different.
Well, they were tier 1,
And they've changed.
right.
Okay. Well, let's go to tier 1. So typically on the provider site, they have a list of accepted insurances. Just takes a little bit of digging. And it could very well be that they don't take it anymore and the contract just hasn't been updated with Humana, which means they wouldn't have updated their website.
Okay.
So the websites are not always hard and fast, yes they do or yes they don't. It's kind of more of a reference of who to start with. Here's a list of all of them that do take it. And then cause you still have to call and make the appointment. And usually when you call and make an appointment, they say, well, what type of insurance do you have? Do you have your insurance numbers? All of that fun stuff, because the doctor's offices will run the insurance before the appointment just to make sure that it's covered. And it looks like they don't have their list available. So that's what I'm guessing is, let's see. Yeah, that they just haven't updated their information with Humana, especially with it being so close to the new year. Because insurance is run on a calendar year basis. So typically they don't break their contracts mid-year, they wait until the first of the year. So if the Campbell Clinic was like, oh, just kidding, we're not gonna take Humana anymore, they'll wait until December 31st to cut that contract.
So it must have been a year ago, if that's true,
Yes,
because
Yeah.
it's been several months since we were told that.
yeah. And the insurance companies are not the most, reliable when it comes to updating the provider list, just because they're massive. Like you saw in our area, there's over 20
Okay.
providers. If that's the case, if that happens, what you can do is contact either Humana or me, and I can reach out to them directly and just say, hey, your provider list is incorrect. Can you please update it? Because Humana just goes off of what the doctor's offices tell them, and if they don't renew the contract, Humana doesn't go through and call each provider that they have contracts with at the beginning of the year. So sometimes it just slips through. And it's the same with any insurance company. Blue Cross Blue Shield is pretty bad about it just because they're such a large company and everybody takes them. So that is the issue that you run into when it comes to that. And again, this is just more of a starting point frame of reference of, okay, I know I need to go get carpal tunnel surgery. Let me look and see what doctors in my area Humana says that they take, and then I can go from there to reach out to the doctor's offices. Because I don't think that any doctor's offices in our area have virtual booking. Like you can't, via an app or something like that, you can't schedule an appointment. It's all calling the doctor's office and making the appointment. that answer that question?
Sure.
Okay.
I'm just saying, I'm in limbo because that Turnbull doesn't take my insurance anymore.
Yeah. Yeah, it's tricky when the doctor's offices switch. And you said that you were looking at another doctor's office, right?
Well, with my insurance, my primary care has to,
Refer.
Gosh, I'm sorry.
You're fine. You're fine.
Refer, and she said Dr. Wilson, that is a hand doctor, is what she said. But I'm not, you're going pretty fast, but I don't see a Wilson, that's okay.
That's what I'm looking for, is I'm looking for Wilson. So it could be that,
and maybe Wilson doesn't take Humana.
yeah, that's, it could be that he doesn't take Humana, or it could be that he doesn't have, because when they submit the information to the insurance providers, they have to check like a box of, yes, I do carpal tunnel, yes, I do brain surgery, like whatever the specialty that they have to put that in there. And some of them just don't fill it out comprehensively. They just say, I'm a neurosurgeon, take that as you will, do with it, with that information, whatever you want to. So from this list, we just put in carpal tunnel. So it could be that he just didn't give that information to the insurance company, that he specifically worked with carpal tunnel, or it could be that he doesn't take Humana. That's another possibility. Let's see. I think that's what his name was. We looked it up. Yeah, it doesn't look like he's pulling up as taking Humana. Might also be that we have the search restricted. And typically, it's not an exact science with your primary referring or the insurance saying these are the people you should look at, because the lists are ever changing, and the doctor's offices, I know some doctor's offices that say that they take TennCare, for instance, but they're not accepting any new TennCare patients. So they'll still show up on the list as accepting whatever HMO for TennCare it is, but then they're like, well, technically we take it, but not really. Because they won't, it's especially true for dental, for TennCare and Medicare, because the offices in our area that provide that are just very limited. Okay, do you have any other questions? No. Okay. Alright, I'm gonna move on to Cigna, and we're just gonna look again. All I did was type in Cigna find a provider. Cigna is only available with Marketplace and Medicare, and then job sponsored. TennCare does not have a Cigna plan. Okay, and we are going to look for, let's see. Excuse me. So in the Cookville area, there is 259 primary care, and this
259.
providers that take Cigna. This could be, because we just put in PCP or primary care, this could be pediatrician, this could be family medicine, this could be internalist. Primary care is a very broad umbrella that a lot of different specialties fall under, but they all can provide primary care specialty or primary care services. Oh my goodness, excuse me.
Let me tell you,
Sorry.
Dr. Sanders came up there again, and her dress has not been church straight in almost 3 years.
Oh, really? This one?
Yep. On Humana, when you pulled it up, it had the correct address.
Oh, it did?
Yeah.
Yeah, and see, that it's just how it's just the communication between the insurance company and the provider's office, because some insurance companies are really great about communicating and saying, hey, do you have any updates? And some doctor's offices are really great about that. And others are like, it's fine. It'll be fine. I'm gonna go back and look. We're gonna look for a cardiologist. And now that narrows it down. There's 86 in our area. And it gives the specialty, the hospitals that they're affiliated with, and then the education. Typically it says they're accepting new patients or not. It is not pulled up on here. Because I don't have a plan selected. Okay, there we go. So it says in network, which just means that it's in, the provider is in network with the insurance, and then accepting new patients, again, just the little check mark means that they're accepting new patients. There are some doctor's offices that are just at capacity because a doctor can only have so many active patients at a time. And so they won't accept any new patients unless you are already an established, have been going.
Is that their choice or someone else's choice?
A little bit of both. So the insurance company typically says you can only have X amount of Medicare patients or X amount of TennCare patients. And there's a whole calculation that the insurance company and the doctor's office does that says, okay, you can have 95 Medicare patients. But then the doctor's office, if it's just like a single person at the office, they're like, I can't see 80 people a day. So they have to limit themselves to what are they able to, the capacity that they're able to have. So it's a little bit of both. When coming up with accepting new patients or not. I think it's more on the doctor's office, especially in our area, just because there's so many people that are now living in Cookeville and surrounding areas. And the amount of providers has been going up, but it hasn't been going up as fast as the population has been going up. Okay, so that was Cigna. Done that. Okay, we are going to go back to United. And we're going to do a state exchange for United. The state exchange is just a marketplace. Type C. Just to give a little bit of variety. We are not in Knoxville, we're in Cookeville. let's look up clinics. We're gonna do urgent care clinics. Okay, so there is 2 in-network urgent care in the Cookville area. I don't even know where that is. I have no idea what this is. I know that the physician's care is one that takes United. And again, this is where it comes down to, okay, well, like I know that the Cookville Regional Urgent Care takes United, but it's not showing up on here. So it gives us at least a little bit of a starting point. If you need to know quickly an urgent care that you need to go to, okay, well, I'm pulling this up, physician's care on North Willow takes it, let's go there. And this, again, is an exchange, which is the marketplace. So the places that take marketplace plans, just like Medicare or TennCare, are not the same. So I know a lot of places that take Blue Cross Blue Shield or United for Medicare or TennCare that do not take it for the marketplace, just because the payout is different. The amount of money that the office is getting is different. So they don't take those plans. Let's look at imaging. Advanced diagnostics, Cleveland radiology, a lot of places that take this in the Cookville area. And again, just to get to these lists, literally all I do, once it lets me get there, is Google, find a provider, UHC. And then there'll be a whole bunch of different links that pop up. And you can see, let's see. Typically it's, so United Healthcare Community is a TennCare. UHC Feds is a work sponsored coverage. Dual Complete is a Medicare. So if you have United Healthcare Community, you'll look at this and say, oh, I know I have United Healthcare Community, that's the one I need to click on. But you can also just go to the direct UHC site. I'm going to continue with a guest because I'm not signing in. And then from here, it will say what type of plan do you have. So you could say, I have a Medicare plan, or I have a Medicaid plan, which is TennCare, or I have a marketplace plan, or I get my UHC from my employer, my family's employer. So you can narrow it down this way as well. Alright. Now we're gonna go into Blue Cross Blue Shield. Gonna continue as a guest, because I don't have accounts to all of these. We're in Cookville. Blue Cross Blue Shield is slightly different than all of the other insurance companies, because Blue Cross Blue Shield has different networks. So even if you have Blue Cross Blue Shield but you live in Cookville, we have Network S and Network L available. People in Memphis have Network S and Network E available. So there are different networks in different areas. What we have here is different than what people in Knoxville have, what people in Nashville have. I don't know why they do it that way. They can't tell us. It's just the way that they do it. Network S is statewide. So everywhere, every region across the state has Network S. It is the most widely accepted. Typically, Network L and Network E are more narrow. They are least expensive. So it's either through your provider, through the marketplace, or through Medicare. But you have a narrowed list of providers to choose from. So we're just gonna look at Network S today. And we'll do, actually, let's do OB/GYN. What's a specialty? And there are 12 OB's offices in our area that take Blue Cross Blue Shield. And then you'll also see, I didn't mention this earlier, TennCare Select, Cover Kids, Choices, Katie Beckett. Because this is one of the providers that TennCare covers, there's 3 that TennCare do, Blue Cross, United, and WellPoint. They also have all of the different TennCare categories, because different, like those people that are on Katie Beckett are different than the people that are on Cover Kids. So those networks and those providers are going to be different, which sounds so confusing. Like, why can't they all just make it one network and make everything more cohesive? But that's not how they choose to do it. So let's look at Cole. He's one of the big OBs. And Blue Cross is really good about putting, okay, well, he takes Network S, but he also takes P, and he also takes Blue Care, and he also takes Cover Kids, and TennCare Select, and Blue Advantage PPO, which is a Medicare Advantage plan. So it breaks down all of the different plans that they will take, which is super nice. Okay, and then we'll go to WellPoint, which again is just Medicaid. So WellPoint in the state of Tennessee is only a TennCare provider. So we'll just do primary care. Oops. And there is 102 results for primary care.
My.
Yeah. So we'll do accepting new patients. Let's do mail. Let's do. Just do those. Okay, so just by adding those 3 filters, so serving as a PCP, accepting new patients, and mail, it narrows it down to 29. So that brings that 102 down a little bit more manageable. And then you can also look, and I didn't point this out on the other ones, but all of them have this feature where you can see it on a map view. Go away, Benny. There we go. So say that you live down towards 40. You might not want, you might not want to go all the way to the middle of town to find your PCP. You might want to stay near where you live. So this will give you a good kind of frame of reference of, oh, well, these people are closer to 40, these people are closer to tech. It just kind of gives you a different perspective than just seeing the names on a list, which can get kind of overwhelming. And then Aetna. So Aetna is.
Wait a minute,
no,
before you leave that, I want to ask
Go
you
for
a
it.
question.
Yeah.
If you have WellPoint or TennCare,
Mm-hmm.
do you have to reapply every year, or if you're there, can you just? I don't know how you get on TennCare to start.
You're fine. I understand your question.
Okay.
So in order to get on TennCare, you have to meet income and categorical eligibility. So income is, let's just say for a family of 3, if you're a child, you have to meet below 250% of the federal poverty line. If you're a relative caregiver, which is a parent or anybody taking care of the child, you have to fall below 100% of the federal poverty line. Every year, just like with job sponsored or your Medicare, you have to do a renewal. So basically what it is TennCare will send a packet. You can also do it online, but it's a packet. And it says, is this information correct? Basically, or is your address still the same? Is your email, your phone number, the people that live in your household, your income, your assets, like your car and your house and your property across the state, whatever it is. And so they have to verify all of the information that TennCare has is correct. So every year that happens. The way that TennCare differs from Medicare and Marketplace, like Medicare's open enrollment is October 13th through December 1st, I believe. And that's a fixed time. Like that is the only time for Medicare open enrollment. Marketplace is November 1st through January 15th. That is a fixed time. You have to re-enroll. Whereas TennCare is solely based on when you got that original approval. So I have people literally that have it every day. So there's not a fixed time where the TennCare re-enrollments happen. It goes on a 12-month basis from when they got coverage. There are exceptions to that. They call it an ex parte review, where they look over all of the different state benefits that people get, like WIC, SNAP, Families First, all of that other stuff. And if they get WIC or get SNAP or get Families First or there's another one that I can't think off the top of my head. If they get those programs, TennCare says, well, if they are eligible for those programs, they're automatically eligible for TennCare because the income for those programs is so much lower than TennCare. So they'll go ahead and re-enroll them or renew them without the consumer having to do anything, basically. But yes, it is they do have to renew it every year. Yeah.
But at the time that they got it, like if you were covered like from February 1st, February 1st, you probably before that you had to renew it.
Correct, yes. And the only exceptions are that ex parte review if they have other state programs or if they're pregnant. So if they got TennCare because they were pregnant and they didn't fall into any other categories before that, the time frame is a little skewed because you don't have a baby every 12 months. It's a 9 month, like it's slightly different. But traditionally it is a 12-month cycle from when they got the original approval.
Okay.
Does that answer that question?
Yeah.
Okay. All right. And then the next one we're going to look at is Aetna. So Aetna is not on Marketplace, and TennCare does not. It's not one of the programs that TennCare works with. So this is solely a Medicare and a job-sponsored coverage provider or insurance company. So we are going to, let's do a Medicare plan. Gonna do Cookville, Putnam, 2025. Let's do okay, so there's 4 emergency rooms that Aetna takes. And see, I don't think that this is up to date because I'm pretty sure Ascension St. Thomas Highlands doesn't have an emergency room anymore. It's only mental health. And then Riverview, which is way further out.
Wait a minute, is it in Sparta? I think they do. Or is it just for Cookville?
Does the one in Sparta have an emergency room? I thought it was just mental health.
In Sparta?
Uh-huh.
No, it's not.
Oh. I could very well be wrong.
No, I'm the one that could be very wrong.
Well, these are the 4 that it's pulling up that has emergency rooms. Cokeville Regional, Livingston Regional, Ascension St. Thomas Highlands, and then Riverview. And I don't even know.
Is that Ascension St. Thomas Highland? Is that Sparta?
Yeah, that's the one in Sparta.
Really? I don't think that's just mental health.
I think you're right. I think I might be thinking of something different. And then the one in Carthage, the Riverview.
Okay.
So there's 4 in our area. And the other thing I'll say about emergency room is, say that, it's not really prevalent here because our emergency rooms are so few and far between. But say that you're in Nashville. So let's do Mount Juliet. So say that let's just pretend that you go to a TriStar. TriStar's like, oh, they changed. Give me 1 second, I'm gonna find one that they don't take. Okay, just for argument's sake, let's say that they don't take HCA. That Aetna does not cover HCA, which is the TriStar plans. But let's say that you're having a true medical emergency, like you are having a heart attack, or you are about to push a baby out and you cannot wait to get to the nearest hospital, and there is one right down the road. If it is a true medical emergency, they will waive the in-network until that emergency is over. So say that you are having a heart attack. You don't look up and say, where's my nearest emergency room? You go to the nearest emergency room. There is no question. Or you cut your arm off, or you're bleeding out, or something major has happened. So if that is the case, you don't have to go to an in-network provider for the extent of that emergency. Once you are stable and no longer in life-threatening condition, then you have to move or figure something out with the in-network versus out-of-network. But while it is a true emergency, the in-network rule does not apply, which I think is kind of nice and generous of them. And that also goes for if you are out of state. So say that you're visiting your sister in California, and you're like, well, I have Tennessee insurance. If it is an emergency, it doesn't matter if you have Tennessee or Alabama or California insurance. If it's an emergency, you go to the emergency room. It doesn't matter what insurance you have because they waive the in-network, out-of-network policies. And that is true for any insurance, whether it's job-sponsored, Medicare, TennCare, Marketplace, regardless of what plan you have, that is true. Okay? That's all I got.
Okay.
Do you have any other questions? Yeah.
Can I get to all this information?
You can. I can send it to Spencer. Is there a way for you to put it up?
Yeah, I can, if you send it to me, I can print it out for you and I can give it to you before the end of the day, or I can post it if that'd be better too.
What information specifically are you looking for?
Well, I just thought that you pulled up Humana and you went through that, all kind of doctors and everything.
Mm-hmm.
Do I have the opportunity to do that?
Absolutely. So all you do, and this is literally all I do, is I Google, find a provider, Humana, oh my gosh, I can't spell, Medicare. And it pulls up a whole bunch of different links. I usually go to the first
Find
one,
a provider, Humana.
Humana Medicare.
Okay.
And it usually pulls up, for any insurance, it pulls up a whole bunch of different results.
Okay.
Usually, I would say 9 times out of 10, the first one is the one you want to go with. Because it hits all of the words. And then the next page is literally the Find a Care page. And you can either create a My Humana account if you have one. If you don't have one, it doesn't really matter. Or you can browse as a guest. So you don't have to put in any of your personal information. You can just look at the general information that they have. And then let's say that you live in Sparta. and you get a Medicare plan. Or you can put in your member ID, which is, it's on your Humana card, and it'll look up the plan for you. And then let's say that you have that honor PPO. And then you just go from there and you type in whatever, I want a primary care, or I want a neurologist, or whatever it is that you're looking for.
Pretty interesting.
And it's, again, it's available to the general public, like you saw, I just Googled it, and that's what I do. People are like, well, do you have like specific links? No, I have Google. That's what I do when I do insurance every single day. I have Google to get to the different provider pages. And there are links. I mean, I have links for like Marketplace and TinCare and all of those. There are like specific links that you can type in and follow, but for me and for just the general population, it's easier to just Google it, because Google will pull it up for you and it'll do all the hard work.
Okay.
Yeah.
Okay.
Are there any questions?
I don't think so. This one actually just died a couple minutes ago. So
Okay.
I don't think so.
That's all I have.
Okay.
Thank you, Callie.
Yeah.
Thank you.